today's session. We encourage you to please use the chat and Q&A functions. Please use the chat function at the bottom of your screen for any questions about technical difficulties, and please use the Q&A function for any questions that pertain to the RFP. Great. And we'll go on to the next slide. Oh, and please know also that we have a lot of time at the end of today's presentations for questions and answers, and we will do our best to get to every question today, but we will post them on the Community Benefits website by the end of the week. For some context, we'll start by providing a bit of information about the Community-Based Health Initiative, CHI, and how we arrived at the priority areas. We'll also spend the most of today's session talking about the RFP specifically and really diving into detail. And we will also talk about the different funding tracks that are available. We'll then review the RFP timeline before opening it up for Q&A. What you're looking at now is a very high level example of the information that we are talking about today. Please know, like I said, we will dive into great detail on this in just a minute. Through this RFP, Beth Israel Deaconess Medical Center will be distributing about $6.6 million over the next 3 years. This is the first of 2 distributions of that amount. This funding opportunity is focused on 6 specific neighborhoods in Boston. The neighborhoods are Allston Brighton, Bowdoin Geneva, Chinatown, Fenway Kenmore, Mission Hill, and Roxbury. We're funding programs in 3 priority areas. The areas are housing affordability, jobs and financial security, and behavioral health, including mental health and substance use. Applicants will be selecting from 3 funding tracks. We will provide more information about each track in just a minute. And please know that letters of intent, or LOIs, are due on August 28th. I will now turn it over to Nancy Kaysen, the Vice President of Community Benefits and Community Relations for Beth Israel Lahey Health, who will provide you with additional information about the Community-Based Health Initiative and its background.
Thanks, Robert, and thanks, everyone. We're thrilled that you are joining us, and we are very, very excited to be hosting this bidders conference and have issued the request for proposal. I'm going to provide you, as Robert said, with a little bit of background as to how we got to this place in these next series of slides. So as many of you know, the Department of Public Health, the Massachusetts Department of Public Health determination of need requirements for the Community-Based Health Initiative that Beth Israel Deaconess Medical Center distribute 5% of the total capital expenditure for our new inpatient building. This is BIDMC's first large capital project in over 20 years. So we are so excited both about the building as well as this community-based health initiative. So over the course of the next 6 years, we'll be distributing about $18.4 million. And for this request for proposal, the first 3-year cycle is about $6.6 million. The funds, as Robert already said, will be distributed into the community, into the neighborhood specified, and to address social determinants of need and social determinants of health. To guide the funding process, we created a community advisory committee that helped work with us and engage the community in a variety of ways, including holding community meetings. We also formed a separate allocation committee, and this allocation committee does disclose any potential conflicts of interest, and the allocation committee will be the group that will be reviewing the request for proposals and will be helping to decide on the awards of the funding. You can find additional details about our transparent process. All of our community advisory committee meetings were open to the public. We welcomed both written and oral comments throughout our process in an effort to both engage what we call non-usual community members as well as usual community members, to allow individuals and groups to weigh in and provide additional insight that might not have been captured during our process. All of that information is available on our website, and the website will be at the end of the slide deck in case you don't already have it. Next slide, please. Oh, do I advance them? Sorry, thank you, Anna. So we are incredibly grateful to our advisory committee. The advisory committee is now called our Community Benefits Advisory Committee. This group of individuals has helped to guide our CHI process since October of 2018 when we first kicked off the CHI. Members of the committee represent a number of different sectors and perspectives. Their input has proven to be absolutely invaluable, and we are so deeply appreciative of both their time and their commitment to our process. Throughout the presentation, just as a nomenclature note, we will be referring to the Community Benefit Advisory Committee simply as the Advisory Committee. In addition to the guidance provided by the Advisory Committee, the selection of our priority areas that were also very largely informed by the work of the Boston Community Health Needs Assessment Community Health Improvement Plan Collaborative, or the Boston Chennault Shift Collaborative. BIDMC is very proud to be a founding member of this collaborative, and I actually serve as the co-chair of the collaborative steering committee. For the citywide needs assessment, the Boston Chennault Shift Collaborative, or the Boston Collaborative, conducted over 13 focus groups, more than 45 key informant interviews, nearly 2,500 surveys of Boston residents, with a particular focus. The collaborative's particular focus were on those who are typically or usually not included in such assessments, and that was very deliberate. The selected priorities, so the Community Benefits Advisory Committee, or the Advisory Committee, used the findings from the collaborative, the collaborative needs assessment to both to inform our community engagement process and additional engagement that we conducted, which I'll outline on the next slide, as well as to inform the selection of the community-based health initiative priorities. So you'll see throughout our request for proposal, and we encourage, and we do reference the Boston Chennault Shift Collaborative in the proposal, that our priorities very closely align, and are it's very intentional how much they align with the Chennault Shift Collaborative's priorities. And so we do encourage our future grantees to be part of and actively participate in the collaborative going forward. On this slide, I also want to just mention that in addition to the efforts that we undertook with the collaborative, next slide, sorry, slide 8, that in addition to the efforts that we took with the collaborative, we also did some additional community engagement and communicated some of the priorities that were outlined by the collaborative to help us hone in on specific needs, areas, and priorities within our focused neighborhoods, which again, were Alston, Brighton, Bowdoin, Geneva, Chinatown, Fenway, Kenmore, Roxbury, and Mission Hill. So we had small group discussions led by independent facilitators about needs and assets. Many of those group discussions were also an effort for us to build community capacity by training community residents and community stakeholders to become and or co-facilitate. That was something that was critically important to us. The graphic on the right shows a few highlights from our process. I'm not going to go over that, but we've made an intentional effort to both build capacity, to highlight businesses and locally owned restaurants and food vendors throughout our process, and to be as transparent and engaging as possible as we undertook our community engagement and our priority selection process. Next slide, please. Thanks. So after reviewing all of the information, both both from the Chinant CHIP Collaborative as well as from our additional community engagement and working with our advisory committee. The advisory committee approved a series of priority areas, sub-priority areas, and allocation percentages for the CHIP funding that are evidenced on this slide. So 40% of the CHIP funding will go to housing, housing affordability, of which some sub-priorities will be homelessness, rental assistance, and home ownership. 15% of the CHIP funding will go to select a separate process through the Healthy Neighborhoods Initiative that we won't be touching on today. 30% of the CHIP funds will go to jobs and financial security, much of which maps directly to some of the work of the collaborative in enhancing economic security and addressing economic disparities in the community. And then the remaining 15% will be allocated to behavioral health, which Robert has already explained includes mental health and substance use. So overall, we have both aligned, but also tried to include some of the key issues that we know that were noted and prioritized throughout the large engagement process. The advisory committee also focused on some specific cohorts that include youth and adolescents, low resource individuals and families, lesbian, gay, bisexual, transgender, and queer questioning individuals, racially and ethnically diverse cohorts, older adults, and families and individuals who have been affected by incarceration. These are the focused populations of the RFP, as you, and we'll go into more details once I turn it back over to Robert. So Robert, for RFP details, thanks.
Thank you, Nancy. And before we transition, I just want to answer a question I know a couple people have asked in the chat if we are going to share the slide deck. So yes, we will send it to all attendees and it will be posted on our website as well as the actual recording of today's session. What I want to cover now are some of the details about the request for proposal and what it's really grounded in. And this RFP is grounded in 5 core principles that were created with input from our allocation committee. The 5 core principles in front of you, as you'll see, are health and racial equity, impact, community, sustainability, and moving upstream. And starting with the first principle, we are seeking applications that use a health and racial equity lens to dismantle systems of oppression and work towards the systemic, fair, and just treatment of people of all races, ethnicities, and communities so that all people can achieve their full health and overall potential. We're also looking to fund programs that really show impact in the target populations and neighborhoods by employing the evidence-based and evidence-informed strategies that are listed in the RFP. We aim to invest in initiatives that build community cohesion and increase community capacity by actively engaging with community residents and stakeholders. We want to see programs and initiatives sustain beyond the grant period by leveraging funding, creating partnerships, increasing organizational capacity, or by other means. And we want applications to address the fundamental causes of poor health and racial inequities by creating interventions that move further upstream. And I want to dive deeper in what we really mean by moving upstream. There it is. All right, when we talk about upstream versus downstream, the classic public health example is by the medical sociologist Irving Zola. She describes a witness who sees a person caught in a river current, and the witness dives in the river to save that person from drowning, only to be drawn to rescue other people who she sees who are also drowning in the river current. The witness, after rescuing several other people and reaching near exhaustion, the witness finally gets out of the river and walks further upstream to find out what is causing this problem. The witness wanted to find and address the root of the problem and prevent more people from falling in the river. Through this RFP, we want to move beyond downstream and midstream interventions to solutions that move further upstream. Downstream interventions focus on addressing health outcomes and symptoms of disease. Midstream interventions focus on individual social needs such as housing, transportation, and income. Upstream interventions take place at the policy and systems level, affecting more community-wide change and tackling institutional inequity. We aim to fund programs that move further upstream and that are sustainable after the funding period ends. We are not only looking to fund policy solutions, but we do want you to think about how your program or your initiative can move further upstream or move further up the river to address the fundamental causes of poor health and racial inequities. I'm now going to hand it over to Anna Spear, who will take you through some of the details of the RFP.
Thank you, Robert. So I'm going to start by talking about who is eligible to apply for this request for proposal opportunity. So to be able to apply, an organization must be tax exempt or have 501c3 status or be a public agency. Organizations must also currently serve residents in or across one of our priority neighborhoods. So again, that's Alston, Brighton, Bowdoin, Geneva, Chinatown, Fenway, Kenmore, Mission Hill, and Roxbury. And these neighborhoods were prioritized among those in our service area because we wanted to focus our community benefits efforts on the more urban, high-need areas where the greatest disparities exist. Please note that while the City of Chelsea is one of our focus geographies as well, their allocation will be conducted through a separate process. So the organization that is submitting the application, what's known as the lead organization, must have a strong history of working in one or more of the neighborhoods listed above. We also want to see that the organization's leadership reflects the community it serves on many dimensions, such as culture, ethnicity, race, language, and other dimensions. And we do see the questions coming in through the Q&A. We are seeing those and we'll be answering those at the end of the session. And again, you can use the chat if you're having any technical issues. That goes to all panelists. And the Q&A is for questions about the RFP. So moving on to the structure of the RFP, there are 3 funding tracks in this funding opportunity. So track 1 is called Cross-Sector Partnerships for Systems Change. And this is meant to fund ambitious cross-sector projects conducted by 2 or more organizations that have intentionally decided to partner to achieve systems level impact. So we're really looking for creative, out-of-the-box thinking on this track. And for this track, we anticipate awarding 2 grants of up to $1 million that will be distributed over the 3-year grant period. Track 1 applicants are required to select from 2 or more priority areas. So for example, an organization might choose housing affordability and behavioral health, or behavioral health and jobs and financial security, but they must select 2 or more. They also have to select up to 3 strategic focus areas for each of priority area that they've selected. And strategic focus areas are the sub-priorities within each priority area. And I'll talk a little bit more about this on the next slide. And lastly, for this track, track 1, partnerships are required. So organizations will need to partner with at least 1 other organization to implement the project. Moving on to track 2, our focused investment grants will fund 1 or more organizations to conduct projects in 1 specific priority area. For this track, we anticipate awarding about 8 grants of up to $500,000 each, again, over the 3-year grant period. Track 2 applicants will select 1 primary priority area, but have the option of indicating additional priority areas. Then they'll select from 2 or more strategic focus areas. Again, those are those sub-priorities. So for example, if they've chosen housing affordability, they might select down payment assistance and foreclosure prevention as strategic focus areas. And for this track, partnerships are encouraged but are not required. And last but not least, track 3, called Capacity Building Seed Funding. This will fund smaller scale projects conducted by local organizations that wish to build their implementation and evaluation capacity. Track 3 grantees might wish to expand an existing program, pilot a new program, and or build infrastructure to support future evidence-based programming. For this track, we anticipate awarding about 6 grants of up to $100,000 each over the 3-year grant period. And track 3 applicants select just 1 priority area and only 1 strategic focus area. So it's a narrower focus. And track 3 applicants are permitted to have partners, though it's not required. And we really encourage you to refer to the full RFP for more detailed information about the tracks, and we'll drop a link to our RFP page in the chat. You can click on both a document that has all of the details about the funding tracks and requirements and the questions we ask in the letter of interest, application form, and there is also a 2-page overview that gives you some information more at a glance at a high level. So we hope you find those helpful. So moving on to the strategic focus areas. As I mentioned, the advisory committee selected sub-priority areas, which we're calling strategic focus areas, for each of our 3 priority areas of housing affordability, jobs and financial security, and behavioral health. And for each of these strategic focus areas, we've selected, based on a lot of research, we've selected evidence-based and/or evidence-informed strategies. And so applicants must select from that list of strategies. We have intentionally made the strategies broad, and so we do encourage creativity within these strategies. So example strategies in the housing affordability priority area include housing first and eviction prevention. For jobs and financial security, strategies include vocational training and youth employment. And in the behavioral health priority area, strategies include building provider capacity through things like telehealth and building community capacity for behavioral health through programs like mental health first aid. So next, I'd like to turn it over to Annie Reshman from Health Resources in Action to talk through the capacity building and evaluation components of the RFP. Thanks, Annie.
Great, thank you, Anna. And yes, everyone, my name is Annie Reshman, and I work at Health Resources in Action, and we've been hired by BIDMC as the independent evaluator for this project. We've been working with BIDMC as well as with the advisory committee on the process to date, and we are also going to be working with the grantees of this RFP in the evaluation process, as well as in capacity building. In thinking about a project like this and the evaluation, it's really important not just to demonstrate the core principles that Robert covered earlier, like impact, but it's also important for entities like the Department of Public Health and BIDMC, as well as the grantees and the community, to know what happened with the money, what was the impact. when we think about that, how will we know that we were successful? How will we know those things happened? First, we'll be working with the grantees to co-design. We will collaborate with grantees to design and conduct an overarching evaluation to measure the overall impact of the funds. We'll also work with the grantees to design grantee-specific evaluations for your specific programs, to measure the impact of the funds to deliver those programs, as well as on outcomes for the people that were served by these funds. Next, we'll also build capacity. If you can go back one, Anna. We'll build capacity, and we're gonna be providing evaluation capacity building for grantees through individual opportunities as well as through a learning collaborative. And we'll cover that in a little bit more detail on the next slide. And then through all of this, what are we going to be able to do? We're going to be able to enhance the data that we have. We're going to strengthen the data collection about the population served through the funding and create opportunities for stronger data to inform future efforts and improve systems and service delivery in the future for your organizations, the community, and others. You can go to the next slide, Anna. And so thinking about the capacity building and evaluation, we do want to make sure that to share that there is a distinction between tracks 1 and 2 and track 3, as Anna covered in kind of the funding guidelines and also the depth and breadth of the priority areas and strategies that you'll be choosing and implementing. There is variation across those tracks. And so the kind of capacity building and evaluation activities are right-sized to align with that. So as I said before, we'll work alongside and collaborate with grantees to co-design that individual and overarching evaluation plan. For tracks 1 and 2, they'll be participating in a 6-month planning process to do that activity. And for track 3, we'll conduct that over a year-long planning process. We'll also work with grantees to assess their evaluation capacity so that we can tailor capacity building and technical assistance to meet the needs of those grantees. And then we'll be we'll build the evaluation capacity based on those assessments. And for tracks 1 and 2, that will be participating in individual evaluation check-in meetings that will be, as outlined in the RFP, will be more intensive at the beginning of the process through the planning period, and then become less frequent as you get into implementation of the programs. We'll also have a learning collaborative for all of the grantees to participate in together, and that will include bi-monthly conference calls or webinars, as well as a biannual half-day learning collaborative. And as we move forward, we'll figure out whether that attendance would also be in a webinar format or in person. And for track 3, we'll also have the individual evaluation check-in meetings on a similar cadence, more intensive at the beginning and then less intensive as you get into implementation. Participants of the track 3 grantees are welcome to attend the learning collaboratives, but it will be optional for grantees in track 3 to attend those. Next slide. And so then we want to walk through an example here. As the committee and BIDMC was working on establishing the priority areas and then taking those priority areas and building them out into what would be the evidence-based strategies that would be included in this RFP. We worked to create causal pathways for each of the priority areas to show the intended impacts of the evidence-based strategies. And so for each causal pathway, we walk through what are the evidence-based strategies, what would the immediate effect be that we would anticipate, what would the intermediate effect be once that programming had been established for a little bit, what would the funding outcome be, so what would happen in the term of this funding opportunity, and what would be the long-term effects, so effects beyond even the funding period of this grant cycle. So to illustrate this, we'll walk through one example in the housing affordability pathway. And so you'll see under the kind of sub-priority or strategic focus area, we're going to walk through an example under rental assistance. So that's one of the 3 strategic focus areas in housing affordability. And one of those evidence-based strategies that is an option for your organizations to choose is eviction prevention. And if you were doing an eviction prevention program, we would anticipate that the immediate effect of that program would be increased access to legal services and eviction prevention programs. And then next for the intermediate effect. So once that programming was underway, we would anticipate through that increased access that you'd see that residents are kept out of housing court and in their homes. And then for the funding outcome, if residents are kept out of housing court and in their homes, we would anticipate that there would be reduced displacement among individuals who received funding or programs of services of the programs. And then this is kind of also the extent of the outcomes that we would attempt to develop measures with you all to collect. So in that process where we would be co-building an overarching and individual evaluation plan with you all, we'd really be focusing on the immediate, intermediate, and funding outcomes shown in the causal pathways. But we also think it's important to highlight and acknowledge that we anticipate that there will be long-term outcomes beyond the funding term. The work that you all do in these evidence-based strategies were chosen because of the anticipated positive impacts on participants that go well beyond just the time of service delivery. And so for this, it's looking at the long-term effect would be reduced episodic homelessness. And then if you go to the next slide, Anna, this is very overwhelming that this is just one pathway that we walked through in the housing affordability priority area. And as you can see, these evidence-based strategies are all driving towards similar or overlapping long-term effects. And a causal pathway like this exists for each of the individual priority areas and can be found on the NIBCHI website. And it might be helpful, we think, as you're thinking about your proposal and what evidence-based strategies you might address in your goals, to look at these and see what the thinking was from the committee and the literature on why these evidence-based strategies were chosen and what the impacts would be. I also want to mention that in addition to each individual pathway, there's also an overarching pathway that shows how the priority areas overlap, and that the Community Advisory Committee is thinking about this funding strategy with these priority areas working together. None of these exist in a vacuum or a silo. Thinking about homelessness, there's a lot of overlap with mental health, and when you work on one of those, you're having impacts on the other, and vice versa. And so we've tried to capture that in the overarching pathway, as well as I think in the funding opportunity, it's really relevant and exhibited in the track 1 funding area. And so that visual is included in the RFP, and it can also be found on the website for reference as you're putting together your proposals. And so with that, I will turn it back over to BIDMC to go into some more details on the RFP.
Thanks, Annie. I will just take the opportunity to mention that the strategies are all described in detail in the RFP. So we will tell you the exact page numbers a little bit later on. We'll make sure that you know where to find it in the RFP, but all of the evidence-based strategies are listed out by priority area. Also, the priority areas, again, I know that this is a lot of information to take in at once, so our 3 priority areas, again, are housing affordability, jobs and financial security, and behavioral health. Okay.
And Anna, I just want to add for folks, as we see questions coming up, that all of this information, as well as the history of how we got there and the process, are all available on our website, and the website and information will be posted on the very last slide.
Great, thanks, Nancy. And Jamie, if you can go ahead and put in links to the full RFP and also to our RFP website in the chat. That'd be great.
Absolutely.
Thanks. Okay, so moving on to funding guidelines and budget. We wanted to outline what you can use the funds for and what is not allowable funding. So funds can be used for project staff salaries, data collection and analysis, meetings, supplies, related travel, and other direct project-related expenses. Funds cannot be used to provide medical services, and by that we mean any billable medical services. They also cannot be used to support clinical trials or to construct or renovate facilities or capital expenses. And they also can't be used as a substitute for funds currently being used to support similar activities. And indirect expenses cannot exceed 10% of the total budget. And we do recommend that evaluation expenses make up about 10% of an applicant's budget. So for this letter of intent stage, we're just going to be asking for the amount you can be requesting, which can be less than the maximum allowable amount for the track you're applying to. We will be asking for a full detailed budget at the full proposal stage, should your organization be asked back. And there's a question about, can funds be used for billable behavioral health services? The answer is no. And that's actually a Department of Public Health guideline for these funds. But good question. Okay. And we also wanted to touch on the scoring criteria we'll be using for the letters of intent. So we'll be scoring them using the following criteria. So the organizational mission aligns with the core principles that Robert went over earlier in this presentation. That the organization has a history of working in the priority neighborhoods. That the proposed project is feasible and meets a demonstrated community need. That the project is evidence-based or evidence-informed. And as a reminder, you'll need to select from the list of strategies that we describe in the RFP. That the goals are reasonable and aligned with the core principles. And that the requested funding is reasonable for the proposed activities. And that the collaborators or partners that you list would increase the impact of the project should you have partners in your application. And check out the full RFP for the criteria we'll be using to evaluate full proposals. That's in one of the appendices in the RFP. Okay, so I'd like to transition to my colleague, Jamie Goldfarb, to walk through the RFP timeline.
Thanks, Anna. So welcome everyone again. This timeline provides a roadmap for the application and our selection process. Right now, the main date to keep in mind is August 28th, and this is when our letters of intent are due. Please note that the applications will be submitted through our online portal called Submittable. I'll post a link after I'm done talking, but all of this information about creating a login for Submittable can be found on our RFP website. We'll be notifying applicants about whether they're invited to submit a full proposal on September 21st, 2020. We've included the full proposal application questions as an appendix, which is Appendix D, in the full RFP so that you can see what to expect. Full proposals will be submitted through the same online platform Submittable as the letter of intent. So now I'm going to transition back to Robert, and he is going to kick off our question and answer section.
All right, thank you, Jamie. Thank you, everyone, for your questions. I see they're coming through the chats, and we are thankful for those questions. A couple questions did come in advance of this session, so we have those prepared already. And the first question was, can an organization apply in more than one track? So we've broken it out by as a lead and as a partner. And you can see as a lead organization, organizations can submit a maximum of 2 applications as a lead, though they must be in different funding tracks. For example, you could have a track 1 application as a lead and a track 2. Please know that the reason why we have done this is because we really want people to be creative about track 1 initiatives. That's an opportunity for sizable money to really go upstream, to be collaborative, and to be innovative, and to really think outside the box and how we want to address the health needs in the priority neighborhoods and populations that we discussed. We understand that there's only 2 track 2 grants that will be awarded. So we know that some organizations might be hesitant to only apply there, which is why we've opened it up to a maximum of 2.
Sorry, Robert, 2 track 1.
Yes, thank you. 2 track 1 grants, thank you. I do want to be clear that it would be highly unlikely that an organization would be invited back to the full proposal stage as a lead on more than 1 application. So please know that. The second part of this question is, as a partner on other organizations' applications, an organization can be listed as a partner in multiple applications across different tracks, though organizations should consider their capacity to complete their responsibilities should they be granted, should they be chosen for more than 1 application. And we are very serious about this and expect that organizations would not lend their name or partnership to more applications than what they could really commit to. So we want people to really be thoughtful about that before joining any proposals. The second question was, can an organization choose alternative evidence-based or evidence-informed strategies for a strategic focus area? No, they cannot. The evidence-based and evidence-informed strategies are listed in the RFP. Our Community Advisory Committee submitted these to the Department of Public Health. The Department of Public Health approved these strategies as the strategies that we will employ in this process. Please let us know if you have any further questions about those strategies, and please know that when you apply in submittable, you will have to actually select from a checkbox of the strategies that you are employing. And then we know a number of other questions have come through the chat as well. So I'm gonna take one about healthy neighborhoods that's come through before turning it over to other questions. But the question was, will healthy neighborhoods be covered in depth in a separate session? The healthy neighborhoods category or priority is still being worked out right now, and the advisory committee is working on defining the exact criteria that will be published, and then the healthy neighborhoods grants will be staggered over the next several years. So there will likely not be a big session like this, but there will be neighborhood specific sessions that we will announce at a later date. And great. And then Anna, feel free to answer any questions you see coming through. And I think just wanting to own, ideally in a pre-COVID world, we would have all been together in the same room and would have seen each other and been able to answer live. And so trying to triage the questions via Zoom as we go through. There was a question about, do we accept organizations that have a 501c3 fiscal sponsor? We are getting clarity through the Department of Public Health now, and we will have that posted in the Q&A session once we get clarity from the Department of Public Health.
And there's a question from Simone about, will you be providing exact boundaries for the neighborhoods? We will not, although, so we do ask you you can expand upon how you define the neighborhoods within your application if you feel that's important.
One question.
Go ahead.
Thanks, Anna. One question that came through is about funded partners. And the question is, can an organization be a funded partner on more than one proposal? For example, can the same organization be a lead applicant on one proposal and a subgrantee on the second proposal?
So I think that was addressed in Robert's under 1 on this slide. So again, an organization can be a partner on different applications across different tracks, but we really caution you to consider your capacity should multiple projects receive funding. So we will be looking at, how many organizations are sort of listed on many applications, and we'll keep that in mind as we review applications.
There's a question asking, do the majority of beneficiaries of this program need to be in one of the neighborhoods listed? And the answer is yes. The organization must have a strong history of working in the neighborhoods listed and be able to describe that. And there's opportunity, as Anna said, in both the LOI and the full proposal stage to do that. Another question is, can we apply as a collaboration or collaborative between organizations in Chinatown, Dorchester, and Chelsea? And I'll look to Nancy as well. This RFP is Boston specific, and we've outlined those neighborhoods there. There is a separate process taking place in Chelsea, and we are working with their integrated, guys, I'm blanking on the name, ICHNA, the Integrated North Suffolk Community Health Needs Assessments, and their affiliated working groups, as well as the City of Chelsea.
Yeah, so Chelsea will be, as we've mentioned earlier on, that Chelsea will be handled separately and is not included in this request for proposal. BIDMC has worked very closely with the North Suffolk consortium, as well as Robert already said, the ICHNA. And so funding will be going to support the work of the Community Health Improvement Plan that has been drafted through a community engaged process. Specifically, and it does align, our priorities do also align with those selected through the community engaged process for Chelsea.
There are two more questions about neighborhoods and serving exclusively. One says, do organizations need to serve residents in the specified neighborhoods exclusively? And the next question said, would an organization serving individuals across the Boston area be eligible? So we understand that many community-based organizations do work in these neighborhoods, as well as in additional neighborhoods. So we provide you with the opportunity to explain how these funds will be directed and targeted to the priority populations and neighborhood, still understanding that you may have other programs and other neighborhoods that you work through.
And I will just mention to the question about whether eligible organizations need to be based or have an office in those neighborhoods, the answer is no. So, you really have to show a strong history of working with one or more of the priority neighborhoods and explain how the funds will be used to benefit populations in these neighborhoods, but you do not need to be physically located in one of the neighborhoods. And there's a kind of related question here about considering the need to demonstrate history with a neighborhood, history of working with a neighborhood. How should an organization document work with individuals who are experiencing homelessness or housing instability, those who may not have a zip code for the RFP? It's a really good question. I think if you can demonstrate kind of the outreach and sort of the activities you do taking place in the neighborhoods, I think that would be a good approach to sort of demonstrating that you have a strong history of working in the neighborhoods, even if you don't have data to support where the individuals themselves are located.
I was going to jump in that there was a question about the causal pathways and wondering if you needed to create your own. No, you do not need to at this stage create your own causal pathway. The ones that were developed for the committee on these priority areas, we hope are helpful in guiding some of your thinking about the strategies and how they might align with your goals. For applicants that are invited to submit a full proposal, they will start to create something similar to a causal pathway with their roadmap as part of that application, but not at this time do you need to think about that yet.
A question came through about how many grants will be funded in each track.
Well, I can,
We should just go back to the slide on that.
yep, that's
since
what I
it's
was,
already covered.
yes. Here we go.
Oh, one more.
So approximately 2 in track 1, approximately 8 in track 2, and approximately 6 in track 3. There's a question on evaluation funds. So the funding for the evaluation, the independent evaluation, it was set aside. We didn't go over the exact breakdown of the funds, but you can find that in slides from advisory committee meetings that are on our website. However, we do want applicants to also set aside time for the evaluation, staff time for working with our independent evaluator, and potentially other, that 10% is a rough guideline that we encourage people. So Annie, if you want to jump in.
Yeah, I was gonna say, I can just kind of add to that, that yes, there's some evaluation activities, particularly pertaining to the analysis of the overarching evaluation, that we'll be taking on a large portion of, but we can't do the evaluation in a silo without all of your help and assistance in recognizing that when we ask you to collect data, either process data or data on individual participants that you're serving in service of the evaluation, that takes time. And so wanting you to reflect that in your budget so you're able to conduct those activities as well. So there will be kind of, I think, a lot of partnership in that evaluation.
And Annie, there was another question about evaluation that came through in the chat that I wanted to pass to you. Will the overarching evaluation design be co-designed after the awardees have been selected, or will there be some framework for evaluation reporting available as agencies apply so that there can be an understanding of the evaluation and reporting load?
Yeah, so it will be co-designed after the grantees are awarded. So we're working to co-design that with the awardees. There is some guidance in the RFP around what those activities might look like. And kind of more details would become apparent once that overarching evaluation was co-designed. But I think kind of a good example is that for thinking about tracks 1 and 2 and that overarching evaluation, and even your individual evaluations, what we'd be looking for is collecting individual participant level data and being able to report that back to us. For track 3, we'll be thinking more about process and less about needing to collect that individual level data, understanding the size of those projects. And so those details are in the RFP around what those activities around evaluation and reporting will look like. But the co-design will happen with the awardees after they're chosen in that planning period.
And there's a question about Upstream. The question is, in the opening, you noted you were looking for upstream responses, but many of the evidence-based strategies seem more programmatic, particularly in the descriptions of the RFP. Is there any flexibility in how you work toward upstream? This is a great question. One of the examples that our advisory committee and allocation committee came up with was an eviction prevention program. And the example was, if the eviction prevention program started when the moving truck was there and the family was already served with a notice, how can they go beyond that and go move further upstream? So how can they find out when the family is first behind on rent, moving to the kind of how to make sure that the family can afford their rent, how to make sure that they're not behind on rent. So just kind of thinking, imagining how you move further upstream. And I think this is just to remind folks, the Department of Public Health charged us to really move upstream and also to balance the needs of the community. And so in the thorough and robust community engagement process, we also heard about various needs that the community had. So the strategies chosen was to balance the need to move upstream while we wanted to really respond to what we heard in the community as well. So great point, and I think eviction prevention hopefully is a helpful example.
So we have a question about the format for the LOI and what is required when sending in the LOI. So the questions in the LOI platform are all listed out in detail and align with what's in the submittable platform. So I recommend looking at the RFP closely and having your answers, to the questions. And then you can also open the platform. You'll have to create an account. Sorry, I have a bug in here. You'll see the same questions listed out within the submittable platform, and there's logic built in. So if you select track 3, it'll walk through that you select one primary priority area and one primary strategic focus area. So it will sort of walk you through in the exact same order as it's listed in the RFP. And so all of the required questions we've listed out in the RFP. Most of the questions in there are required. There's a few that are optional. And if you have technical questions with the submittable platform, you can, there's an email listed on our website. And if you have more questions about the RFP that we don't get to today, there's an email, nibchi@bidmc.harvard.edu that I'll flash up here again.
There was a question about capital expenses. And the question was, for the housing priority area, could some of the funds be used for lending capital, for example, for homeowners? And just as a reminder, the evidence-based and evidence-informed strategies are housing first, supportive services for people experiencing for home ownership or down payment assistance and home ownership education, zero and low interest home loans, and foreclosure prevention. So long as funds were used in those areas, it would be acceptable. I think the question was about the slide that says funds cannot be used on capital expense, and that's really meant as bricks and mortar for that organization or any type of renovation of an existing facility.
And Robert, I think also related to the housing category, are funds to be used exclusively for homelessness, or does it also cover displacement from a neighborhood?
Yeah, I think so long as you can tie it to the evidence-informed strategy and the health priority and explain in the LOI how this meets the definition and the criteria, and that would apply across categories, knowing that, to Annie's point, the causal pathway does touch on a number of areas as these priorities intersect to a degree.
Okay, we're just taking a moment to decide on the next question. Thank you all for sending in these great questions. So go ahead, Jamie.
We are also noting all of the questions that come through. So if we don't get to it, in addition to, like Anna mentioned, emailing it to us, we are keeping track of all questions that come through.
And for questions that are relevant for everybody to know, we'll be updating our FAQs document and posting that to our website. So everybody will see our answers to these questions. So there's a question here. In addition to the core priority areas, can organizations concurrently work on other focus areas? For example, mental and behavioral health and physical health. I'll start, but Nancy, maybe you can weigh in on this one as well. I think we recognize that mental health and physical health, in this example are all of it is part of health, and we see mental health as part of a holistic approach to health. So I think there are definitely going to be spillover effects onto other focus areas. We understand that all of these areas are interlinked. So I don't think that this would be, I think we understand that there is a natural synergy amongst the priority areas that we've chosen and also other priorities that are related. So I think you would want to show that the main purpose of your program fits with one of the focus areas that we've selected through the process Nancy went over. But if there are also positive other benefits in other focus areas, I think that's fine. So Nancy, I don't know if you want to add to that.
I think you've sort of hit it. I think that we recognize, and that's part of what we are trying to do, is both be creative in recognizing the intersectionality and interconnectedness of all of these social determinants of health and these priorities. So we recognize that working on one will both either intentionally or inadvertently impact other priorities. That said, the majority of the program and the project that is proposed for funding needs to be focused on the strategies that have been approved by the Department of Health as submitted and vetted through the entire community engagement and work with our advisory committee.
Okay, so there are some additional questions about the neighborhoods. So I'll just reiterate again that your organization has to have a strong history of working in one or more of the neighborhoods, but does not need to be physically located there. So if your agency is located outside of the target neighborhoods but serves them, yes, you are eligible to apply. And I think we also touched on this in this response here, or actually, I think Robert spoke to this. We understand that there are organizations who have serve larger geographies than the 6 Boston neighborhoods that we've listed, and that's absolutely fine. But whatever project you actually are applying for needs to be focused on one of those neighborhoods.
Yes, and there's also a question about partnerships. Do we have a limit on the number of partnerships for track 1? We do not have a limit. However, we want to be sure that the partnerships make sense and provide added value and synergies. So we expect you to explain the reason for the partnership and the impact that added partnership will have.
We have another eligibility question here about whether a partner needs to be a 501c3. So any organization receiving funding needs to be a 501c3 or a public agency or a public agency. And we'll get back to you on the fiscal sponsor question as soon as we have clarity from the Department of Public Health.
And there's a question in terms of focus areas. Are you prioritizing programs that focus on housing, affordability over jobs, financial security, or behavioral health? We're not favoring one over another, but the allocation is broken up in a certain percentage to where the final awardees will closely align to those allocation percentages. I don't know if we need to go back to that slide. Let's see. Yeah. So housing is the largest of the allocated amount, but it would not be correct to say it's favored above housing or above jobs or behavioral health. So again, it's housing affordability, 40% of the 6.6 million will fall in there. 30% will go to jobs and financial security. 15% to behavioral health, and the healthy neighborhoods is in a separate category.
There is a question about funding amounts have been assigned to different funding tracks and priority areas. Has funding amount been designated for geographical areas? So we will be paying attention, but we're very intentional as we worked with our advisory committee on selecting the priorities and sub-priorities and strategies, that we did not want to specifically and solely bucket X dollars for X geography. So we won't say that we will absolutely positively give X dollars to each neighborhood, but we will pay attention to that. But we are really focused on upstream creative solutions and evidence-informed strategies that have impact. And that will really drive our process. And as has been evidenced by some of the questions, there are multiple organizations that are working in multiple neighborhoods. So we are, obviously open to exploring opportunities where more than one neighborhood will be the focus.
There's a question here about whether we can attach letters of support or partnership to the LOI. To the LOI, the answer is no. Apologies, I'll go back to the slides after this answer. But we will be asking for letters of support to be attached at the full proposal stage. So you'll need to list out the partners and a primary contact and a short description of how you're going to be working with the partner in the LOI stage, but we'll be asking for more information at the full proposal stage.
There's another question. Would providing stipends to a core group of high school youth who participate in leadership development and peer-to-peer community health projects be eligible for funding consideration if these youth are not employees? So certainly we would explore and be open to considering stipends for providing capacity development and youth development. That is, something that we are committed to, and so that would be something certainly that would be an option if it's, again, using the proposed strategies that have been outlined.
And there's another question asking of an organization that organizes tenants around preserving affordable housing and touches on several of the target populations would be eligible and competitive. And I just want to remind, and the evidence-based strategies we have, it has been approved that we could drive, there could be a program or initiative that we fund that would drive public policies to prevent or reduce homelessness. So long as it's linked to that or a similar strategy, and the explanation is made clear in the LOI, then I think the answer is yes.
So there's a question about budget. Are you saying we budget 10% for evaluation of our project? And on top of that, there is discrete evaluation money. So yes, we encourage you to budget 10% of your ask for evaluation expenses and staff time spent on evaluation. BIDMC has set aside funding for our independent evaluator to help support you. So Annie, if you want to add sort of what is included, what kind of support again is included, or some examples, that'd be great.
Yeah, so I think that's the like one-on-one or like TA sessions with us to help you think through maybe your evaluation design for your individual program, or how to design a data collection from participants. And so that kind of support, but the actual collecting of data would fall to the grantee, as well as things like conducting their evaluation of their independent program.
So we have a few questions related to how we're thinking about the effects of COVID-19. So what, if any, flexibility should we expect given the ongoing pandemic? And there's another one here about to what degree sort of will COVID-19 relevance of program affect grant decisions? So we did anticipate this question. Obviously, we know COVID-19 has really impacted all of the communities in the Boston area and the organizations that serve them. So we did talk with our advisory committee about this, and we really believe that the selected health priorities remain relevant in addressing the inequities that COVID-19 has exacerbated. However, we don't want to think of these funds as short-term COVID-19 relief funds. That's not the intention of this funding. So we really encourage applicants to take a long-term view with respect to the program or programs they'd like to implement, while also accounting for the impact of COVID-19. So thinking about, you know, building into your programs, you know, changes that have needed to happen because of COVID-19. So if that means that more of your programming needs to be remote, you know, thinking about through that as you prepare your application is what we recommend, but trying to keep a long-term view. Nancy or Robert, is there anything else you want to add on this one?
I think you covered it.
Yeah, Anna, also.
So we're just going to tee up our next question.
There's a question about if an organization was formed 3 years ago, is that going to meet the strong history of working in that neighborhood? We recognize that you know, some organizations have been around longer than others. There are some that have formed due to need in a neighborhood as well. So long as you explain the need to form and your history in the past 3 years of the work that you've done, the allocation committee would consider that.
There's a question here for track 2 or 3. Is there a preference for new programming versus extant or existing programming? I don't think that we do have a preference. You know, expansion of an existing program would be fine. You know, track 2 is a larger amount of funding, so it might be, you know, if you are thinking about a new program, that might be more appropriate than for track 3. But we do not have a preference per se, whatever you think is best for your organization.
There's a question asking if there's a preference in serving a large number of people as opposed to having more in-depth services for fewer people, and wanting to know how that will be scored. I would just point back to the core principles and the key concepts. We're really looking at impact and looking at sustainability and moving upstream. So to just illustrate that in the application of what your intervention entails and why it's your decision to do whatever it is you are doing, but we do not want to prescribe that for you.
Sorry, I'm just going through, making sure we're answering as many questions as possible. There's a question here about, so a neighborhood health, or I think you mean healthy neighborhoods letter of intent is not due August 28th. So just reiterating that the healthy neighborhoods priority area is still being finalized. And so no, that is not part of this specific LOI process. That's out of scope. So there's a question here, are the areas very defined? For example, would Mattapan be included in the Roxbury area? You know, I think, as I mentioned, we're not going to be providing a specific map of how we define Roxbury and Mission Hill per se, but I think use your best judgment. If it's a named separate neighborhood, I probably would not consider those to be part of the same neighborhood. But again, we recognize that the definitions are a bit fluid and that people do move across boundary lines.
I think using sort of the classic when we've been thinking about this, and for the Community Benefit Advisory Committee and the Community Benefit Service Area, we have used what I would consider the classic longstanding definitions to some degree that align with the Boston Public Health Commission's way of defining these neighborhoods. So I would encourage you to think that way. I also want to reiterate that if you have an organization that's serving multiple neighborhoods, across Boston, that the focus again of the grant funding needs to be on the neighborhoods that we have specified in our community benefit service area.
So to the question, how much detail are you looking for in the LOI regarding capacity to track outcomes? Or should it specifically pertain to describing the proposed project? I believe that we have one question related to evaluation capacity in the LOI, but we're not looking for much detail at this stage. We wanted the LOI process to be fairly straightforward and not too burdensome to the extent we could. So more detail will be asked for at the full proposal stage.
There's another question here. If an organization has multiple projects, is there someone from the CHI that can discuss potential ideas and try to decide what project to submit? That answer is no. We are not going to advise on the approach for the application, as we do not want to prescribe your intervention. We recognize you are the experts in your communities and the experts in the work that you do. So we trust you to put forward your best approach for the neighborhood, for the population, and for the evidence-informed strategy that you select.
There's a few questions related to how we define upstream. So, you know, in general, yes, moving upstream is one of our core principles for this RFP. And so I think Robert provided the example about eviction prevention or foreclosure prevention. I think that it does not always need to be upstream, whatever you propose, depending on the track. But we'd like you to think about how you can try to move your program a little bit more upstream. So we do want to clarify that, you know, it doesn't, the program itself does not need to be upstream, but we want you to be moving in that direction. Robert, if you have any other comments on that one.
Yeah, no, I think that's right, Anna. I think we recognize that it takes time for organizations to move upstream. And like Anna said, we want you to think about how your program can incrementally move further upstream and how are you using these funds to do that. And I also think kind of for, say, a track one is where really we want people to think big and move upstream to kind of societal change and how can we get creative about those systems level changes. And I'll actually ask Nancy if you want to speak to this as well.
Yeah, I just think I want to thank you, Anna and Robert. I also want to just underscore that this is a requirement of the Department of Public Health Determination of Need Community-Based Health Initiative guidelines, that there is an expectation by the Department of Public Health that we as BIDMC and you as potential grantees be thinking and moving more towards root causes and addressing root causes of the social determinants of health that affect obviously health inequities and health disparities. So that is the lens by which both the evidence-informed and evidence-based strategies have been put forth, vetted, and approved by the Department of Public Health. And that's what we're sort of talking about when we keep talking about upstream impact. That is an expectation of the Department of Public Health in their guidelines.
And again, we did make an effort to define the evidence-based strategies quite broadly. So for example, there's a question about funding policy advocacy. I think that there is in the housing priority area, for example, policy advocacy is one of the evidence-based strategies. And, you know, I think we encourage you to think creatively within the list of evidence-based strategies. Some are very, very broadly written. And we really, you know, our intention is not to prescribe ways to achieve the outcomes, but we did need to meet the requirements of evidence-based and evidence-informed approaches. And so we very carefully selected a list that met that criteria.
There was a question asking about homelessness versus anti-displacement work. I'm not sure if there's more to the question, but I hope Anna's response now covers that with what's included in the evidence-based strategies there. But if you want to add additional detail in the Q&A, feel free to provide for a further question there. And just as a reminder, we have just about 8 minutes left. So please ask any questions now, and if not, you could always email the NIDCHI account as well. We'll cover those deadlines in just a minute.
There's a question here that just came in about if there's a workforce development chart similar to the one that Annie showed for housing. Yes, the individual causal pathways are all located. So this chart, I believe you're referring to. So yes, there is a causal pathway for the other 2 priorities as well that's posted on our website, and we'll link to that again in the chat. And in addition, the overarching pathway that shows how these 3 priority areas intersect with one another is in one of the appendices in the full RFP.
There's a question of, is applying for funds to sustain existing strategies eligible for funding consideration rather than expanding? So as, I don't remember which slide, these funds are not meant to replace existing funding streams. And there is, through the RFP, in the, if you look at it, there is a whole section on sustainability and the expectation that grantees will have a sustainability plan and mechanism post funding.
And we can link to that individual causal pathway in the chat as well. So I think we have time for maybe 1 or 2 questions, but we also are cognizant of time.
So there's a question that says, assuming they meet the eligibility guidelines, can a lead agency apply in more than one neighborhood? Again, we're not looking for for one organization to apply in only one neighborhood. That is a possibility. But if an organization is working in more than one of the specified neighborhoods in the BIDMC's Community Benefit Service Area, then certainly those can be covered in the same grant application as applicable.
There's a question asking us how many LOIs we are anticipating. We really don't know. Clearly, there is a lot of attendees today, and we are grateful for that. But we will be thorough and ensure that each one will be read and reviewed thoroughly. So we appreciate your time and efforts when you submit those.
Okay, so I think that's probably all we have time for. However, as Jamie noted, we will have a record of all of these questions, and we'll be following up later this week. But we really appreciate all of the questions that came in. And we'll be sending out both these slides and the FAQs later this week. Robert, do you want to close out?
Yeah, just thank you so much, everyone. Please pay special attention to those dates right there, especially the August 17th date. No questions will be answered after August 17th. So please ensure that you have any final questions asked by then. Thank you so much, everyone, for your time today. Especially huge thanks to the team here at BIDMC who've been working hard to bring this all together. So Nancy, Jamie, Anna, and everyone who's been a part of this, deeply grateful for your time, and we look forward to reading your letters of intent and hopefully inviting back many of you to the full proposal stage. So thank you, happy Monday, and we'll talk to you again soon.
Thank you, everyone.
Thanks, everyone.